Since the start of the pandemic, we've been investigating conditions inside our state's correctional facilities. Critics say many have dodged accountability, with jails being some of the worst culprits. Focus investigative reporter Paula Vasan is the first reporter to go inside the Louisville jail since the start of COVID-19, demanding transparency about a potential source of community spread.
This is not a protected or privileged phone call.
For 7 months.
To accept charges, press 1.
We've been investigating conditions inside our state's correctional facilities.
So have you tested positive for COVID?
Yes, I did on the 16th.
Speaking with inmates.
I've tested positive for COVID 3 times.
They have not given us no treatment.
And their worried family.
I miss his smile. He's just my baby.
Her son is 24-year-old Aaron Smith Spencer.
He'll do anything for his mom.
Now an inmate at Louisville Metro Department of Corrections.
It's more people sick than they are saying.
He tells us COVID is being downplayed.
They are not testing people like they say they are.
And behind these walls, he says cries for help are often ignored.
We are suffering.
University of North Carolina researcher Lauren Brinkley Rubenstein has been studying outbreaks at correctional facilities nationwide.
We continue to see facilities move in and out of outbreak with no strategy to mitigate risk over the long term.
Putting communities at risk too.
That can really balloon neighboring communities' case rates.
But she says it's hard to get an accurate snapshot of what's actually going on. She says different types of facilities have different ways of tracking and analyzing their COVID cases, from how they determine who gets tested to how they manage positive cases. It makes a fair comparison nearly impossible.
The Kentucky Department of Corrections oversees state prisons, reporting COVID cases online daily. But critics say jails haven't been as transparent. They often have less resources and operate independently. But this jail tells us from the start they've been forthcoming about how they're handling COVID-19. We went inside to get answers.
Steve Durham is the jail's assistant director. This is the first on-camera interview jail staff has done since the start of the pandemic.
Who do you report COVID-19 cases to?
So we report to the Louisville Metro Public Health and Wellness.
Louisville Mayor Greg Fisher has also revealed their COVID cases during media briefings. We asked whether, for the sake of transparency, they'll publish their numbers online as well. Following this interview, he told us they will over the coming days. We asked about inmate concerns.
Some inmates have told me that they have to beg for cleaning supplies. What's your reaction to that?
That's not true.
Durham wouldn't allow us to inspect conditions ourselves, citing safety concerns. Instead, he showed us photos of cleaning taking place.
Deep cleaning is happening every shift, so 3 times a day. Clean supplies are plentiful.
He brought out these masks every inmate receives.
We give them 2 masks.
And protective equipment for officers interacting with inmates who test positive.
Are your staff always wearing masks?
We know it's not 100%, and so, but is it over 90? Yeah.
As for their COVID case numbers,
I think we're doing a very good job with it. You know, nobody's doing a perfect job.
Since March, about 41% of inmates who've gone through these doors have volunteered to be tested.
It's free and it's voluntary, but not everybody will take the test.
Of 3,817 inmates who've been tested, 235 have tested positive.
And we keep them under observation, separated from the inmate population.
He says no one has died from the virus while in their custody.
We have got our eyes on it. We are paying attention to it.
He admits there are challenges outside his control, obstacles often unique to jails compared to prisons, which are designed for long-term housing. Among jails, many more people are moving in and out, which means greater risk for the virus to spread.
If the population were to drop, we'd be able to spread out and have less of that congregate setting interaction. That I wish we could do today.
Would you say that's been your biggest challenge?
That truly is the biggest challenge.
But inmates complain the decisions they do make are inadequate.
We're literally watching this disease spread like wildfire here.
In an open records request filed with the city government, we learned the jail doesn't have a written COVID-19 policy for treating and testing inmates. State prisons don't have one either, saying individual treatment is decided by medical providers. Durham says they're evolving pandemic protocols every day, following public health guidance.
We're constantly looking at ways to improve on what we've done.
But this mother,
I'm scared.
says the phone calls she gets twice a week from her son
Can't wait for him to come home.
paint a worrisome picture.
They need somebody from the outside looking in to come in and see what they're doing wrong.
She says jail staff
We're not ignoring care. We're not ignoring patients.
and inmates
I've asked for the nurse for help like 5 or 6 different times.
have two sides of a story.
We're taking it very seriously.
Can't catch my breath. My chest is caving in a little bit.
With lives both inside the jail and out in the community at stake. For Focus, I'm Paula Vasan.